senescent cells and Senolytics, how do they compare or interact with other health supplements like NAD+, for example?
Great question. So I think we might talk about this later on, but there are hallmarks of aging which have been identified. There are now 12 hallmarks. These are things that can go wrong with aging, and if you exacerbate them, you age faster, and if you target on them, you age slower, but they're all linked. So if you affect one of these hallmarks, the other 11 hallmarks seem to improve. So NAD metabolism is indirectly linked to senescence. So if you treat cells with an NAD precursor, NR, NMN, or others on the market, you can improve mitochondrial function. And if you improve mitochondrial function, it actually reduces senescence and inflammation. And if you drive cells into senescence, there's mitochondrial dysfunction and the NAD levels drop in your body. So they're all linked. So I think if you're taking an NAD supplement, an NAD precursor supplement, it probably reduces your senescent cell burden to some extent. And if you reduce your senescent cell burden, it probably increases the level of your endogenous NAD levels. So they're all linked. So I think that NAD precursors in animal models have been shown to be very effective at extending healthspan. The data in humans is still not as solid, and I have to say for many supplements on the market, there's actually very little evidence that they work. Some might, but very little evidence that they work. So you have to be very careful about what supplements you take and really have scientific data to really document that there is a positive effect. The other thing we don't know is the dose of these drugs to take. What's the dose of an NAD precursor and how often should you take it? And these are things that require clinical trials to determine. So self-medicating with a supplement sometimes doesn't lead to a benefit.